There's the Massachusetts male aging study is the largest study of men in the United States. And what it showed that 50% of men in their 50s have some degree of erectile dysfunction, 60% of their men in their 60s, 70% of men in their 70s, 80% of men in their 80s. That's the aging process. That's the way it happens. I've become an expert in understanding the aging process, not just sexually, but also physically, in terms of hormone levels, in terms of muscle loss, as you age. And I'm really focused on what we can do to maintain physical, hormonal, and sexual function for as long as we can, knowing that, like Lenny Bruce said, no one gets out alive.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode. Hi, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Judson Brandeis. He is an award-winning urologist and sexual medicine expert. More about him in a second, but first I'd like to invite you to visit my website, theexplodinghuman.com. Over there you can listen to episodes, read synopses, see photos of all my guests, little bio on myself, and there's a donate button if you'd like to support the show through Patreon. Thank you so much. There's also a YouTube channel, The Exploding Human with Bob Nickman, and you can listen to episodes there, and there's also the Exploding Human Facebook page. As I said, my guest today is Dr. Judson Brandeis, and we are going to be talking about men's health, sexual medicine, testosterone, the prostate, maintaining muscle mass as we age, all kinds of interesting things that I did not know about, and I think a lot of people don't really understand what it's like to age as a man and how we can participate in our own health and rejuvenation. So Judson Brandeis is a font of knowledge in this area. I had such a great time talking to him and learned quite a bit. Anyone who is interested in men's health, which should be everyone, please listen to this episode because there is just a font of information. Welcome to the show, Dr. Judson Brandeis. I watched one of your videos. There's a lot of really cool YouTube videos of Judson Brandeis it's on YouTube. And the one I watched was, the title really made me laugh, and it was just fantastic. What you need to know about your penis. And I didn't know I needed to know any more about it than I do. But I guess I did, because there's aside from the, anatomical stuff, which is really interesting, and, the functions of the different parts, there was something in there that I did not realize. It was that erectile dysfunction can be an indicator of heart disease later on. And that I didn't really realize that. I had never heard that before. Can we start with that? Because I find that so interesting.
Yeah, absolutely. So erectile function is a function of circulation, right? And so your heart pumps, and the two last places that get blood flow are your toes and your penis, right? But you don't get toe erections, right? At least I don't. But you get cold feet, right? Your feet don't get cold feet. Yes. Your feet don't cease to work, and so you put socks on. It's no big deal. But the penis requires a certain level of circulation in order for it to function. So, because basically, when you fill the penis up with blood, it blocks the return of venous blood back to the rest of the body. So what you're doing is you're trapping venous blood into the penis. And so if you don't achieve a certain threshold of blood pressure in the penis, then your penis isn't going to work. It's like being on the top of a burning building and the next building is 6 feet away. If you jump 6 feet to the next building, it's a good day. If you jump 5 feet, it's a really, really bad day. And so if you achieve 100 millimeters of mercury of blood pressure in your penis, it's a good night. If you achieve 95 millimeters of mercury, it's going to be a frustrating night. And so really, you're dependent on blood pressure in the penis, which is a function of your heart pump and a function of your blood vessels. And so if you begin to clog those blood vessels, you're not able to generate that blood pressure. And the blood vessels going to the penis are 1 or 2 millimeters in size, whereas the blood vessels going to the heart are 3 to 4 millimeters in size. And so your blood vessels to the penis are going to get clogged 5 or 10 years before the blood vessels to the heart.
So if there's people out there with erectile dysfunction, they're probably getting it treated one way, but not maybe looking at the source of some clogged arteries.
Yeah. So, I mean, that's really the issue I have with, Hims and Get Roman and Blue Chew and all these online pill mills for Viagra is that you're missing an opportunity to address the underlying health issues that are causing the erectile dysfunction. And I have a lot of patients that I'll send for a coronary calcium score, which is a CAT scan of the heart that looks at calcification in the blood vessels. And lo and behold, guys will have calcium scores of 100 or 200 or 300. My calcium score was 0, right? So anything over 0 is not good, and anything over 100 is really not good. And so I literally have saved people's lives because they came in to see me with erectile dysfunction, and I recognized that they had underlying cardiovascular disease. And I pushed them to get the right study at the right time and got them to the cardiologist.
Is that the test that's like a scan? It's like a body.
So, there are a number of tests for evaluating heart disease, but I think that the quickest and easiest is what's called a coronary calcium score. So it's basically a 1-minute CAT scan of the heart. And then the machine basically counts up how much calcium you have in the coronary arteries. And if it's anything above 0, it's a problem. But if it's anything over 100, it's a real problem. Yeah. And, my brother-in-law is 52 years old. He's otherwise healthy guy. He's a dentist. His calcium score was 800, and he needed a relatively emergent 6-vessel bypass.
Damn.
Yeah. So, I mean, it can happen.
Yeah, that happened to a friend of mine. He was having a little tiredness on the treadmill, and he went to see his doctor. He didn't think it was anything, but he just thought, and the guy goes, "You're going in right now." He took him, he had the, what they call the widowmaker.
Yeah. Well, I mean, thank God he went in. A lot of guys don't go in. And a quarter of guys, the first symptom of heart disease is death.
Yeah.
Let me repeat that. For a lot of guys, 1/4 of men, the first symptom of heart disease is death, right? You don't get a second chance. You can't put another quarter in the machine.
And by the way, death lasts a long time.
Exactly. Just think of all that money that you earned, and now your spouse is going to be finding a younger boyfriend and driving around town in a Porsche.
Well, that's most men's fear, right? That's as soon as I die, she's going to do better. So, that reminds me though, because I was thinking about, you were talking about that you can't increase penis length. This is a little bit of a jump sideways, but when we're thinking about insecurity in women, this idea of penis size, whether it's length or width or whatever it is, seems to be an obsession with American men. I don't get it, but it is a thing. People say, oh, they got a big dick and they're more masculine. And does it matter? I've asked women. Some say it does. Some say they don't care. Some say it's, I personally don't care. I'm not sitting there measuring things or any of that. I never have. Maybe I should get out the tape measure And
So Bob, you're actually talking to the first person in human history to have successfully grown penises. And I'm actually not kidding about that. So, as a urologist and an expert in sexual medicine, I see a lot of men who tried different things to grow the size of their penis, right? So over 50% of men, when they ask them on a questionnaire, do you want a larger penis? They say yes, right? And a very small percentage of those men actually do something about it. And what I mean by do something about it, you can either get fillers injected into the penis or fat transfer. And that's expensive, $5,000-$10,000. And it makes the shaft wider. The head of the penis stays the same. So we call that a pig in a blanket penis.
Where do we call it that? Where are we when this is happening? The urology conventions?
The urology convention, yeah. And then people use traction devices for 6 to 8 hours a day for 6 months to get a longer, thinner penis. We call those pencil penises. And then there are actually now operations where people either cut the suspensory ligament of the penis or even put silicone implants, not for erectile function, but just for increasing girth. And I've seen, a number of men who've had those removed, and it's a disaster. And so as a regenerative urologist, so as someone who helps men get back sexual function through a number of different techniques to build blood vessels, I decided, there had to be some ways to address or fix the problem. And so I use a combination of what's called PRP, or platelet-rich plasma, a stretching device developed by the Mayo Clinic, a suction device developed by Dr. Joel Kaplan, and a circulation boosting supplement called Affirm from Affirm Science, which is a company that I helped found. And that combination of 4 things over about 7 months has improved the length of the penis about 1 inch, the girth about 3/8 of an inch, and improved penis function. And the nice thing is it's totally natural. There's absolutely no downsides or side effects. At the very worst, you don't get any improvement, but actually everyone in the study has improved. It's a clinical research study listed on clinicaltrials.gov, which is the NIH website. It's IRB approved, so Institutional Review Board. So there's oversight, to make sure that we're not doing anything bad. And, I'm a clinical researcher. I've done clinical research with Harold T. Merriman at American Red Cross. He's the guy that figured out how to freeze blood. I've done clinical research in the Marilyn Murray lab that did the first living-related kidney transplant and won the Nobel Prize for that. And I've done clinical research at UCLA under Mark Litwin, who's the father of outcomes research in urology. So this actually is a real study. We just pretty much closed enrollment, and hopefully we'll be releasing our results at the International Society of Sexual Medicine.
Really interesting stuff. The idea of somebody wanting to grow the size of their penis, is that because they're incredibly small compared to the average person, or is it some kind of increased income for a porn star?
No. Okay. So 300,000 women a year get breast implants.
Yeah,
right.
They do.
Is that because they?
Okay. Same reason.
Same reason. So yeah, I would say the average guy in my study has a pretty much an average size penis. There are guys that actually have larger than average size penises, and some guys that have smaller than average size penises. And if you look at most people that do those kind of things, it's not the guys with the smallest penises. It's just people are people, and as long as you're not hurting anyone and spending someone else's money, you can kind of do what you want.
I guess so. The only difference between that and a breast implant is you're not really seeing the results like day to day out on the street. It's not like I always thought women got them as a way to attract the opposite sex and to, outdo the other women and that kind of thing. But, men, it's hidden unless you're somewhere where you're naked.
Yeah. Although, I think it gives guys some self-confidence, some personal self-confidence.
Yeah.
But, honestly, I'm not an expert on breast implants, and I'm not an expert really on the psychology of body dysmorphism. But, I wanted to make it safe. I would get really bummed out and sad when I would see someone come into my office that lost sexual function or lost length of the penis or had, a lumpy, bumpy penis because they went to someone who did something that maybe they shouldn't have done. And so the protocol that I created is 100% safe. The PRP is basically where we take blood, we spin it down, we isolate the platelets. Platelets are packed with growth factors. And PRP is being used in orthopedics to improve healing. It's used in wound healing. It's used in hair growth. It's used in urology. All sorts of indications now are popping up. And so it's basically taking your own platelets, isolating them, re-injecting them. And platelets contain all these growth factors because platelets they cause clot, and then they cause regrowth. And then the traction and the suction devices guide the growth of the penis.
Really interesting. Wow. You've seen how many penises over the last 30 years?
Oh, man.
It's an odd question.
Yeah. I mean, at the beginning of my book, I'm putting on one of my YouTube videos. I say, I've injected penises, I've scoped penises, I've circumcised penises, I've reattached, cut off penises. I've debrided penises from, there's almost nothing medically that I haven't done to the penis.
It's quite a career choice all day long. You're looking at that. It's fantastic. Somebody has to, and it might as well be somebody that cares about it. Like
yourself. My office in Northern California, we're very, very aware of the judgment and shame and embarrassment that people feel. And we really focus on being incredibly professional and incredibly empathetic and understand that it's really hard for men to visit a doctor for those reasons. And so for that reason, we go above and beyond to accommodate people and make them feel like, for example, so say your father was having heart problems, right? And, so you're at work and you're like, yeah, guys, I got to take my dad to the cardiologist later. He's got an appointment. And everyone in the office is like, oh, that's so nice. You're such a nice son, taking your dad to the cardiologist, right? So next week you're like, yeah, hey, everyone, my dad has erectile dysfunction. I'm going to take him to the urologist so he can get a better boner, right? And people would look at you like, what's wrong with you? But at the end of the day, they're exactly the same disease processes.
Exactly. Let's take the shame out of all this stuff. It's just medical. Every man has one. Let's just deal with it the way you would deal with anything.
Exactly. There's the Massachusetts male aging study is the largest study of men in the United States. And what it showed is 50% of men in their 50s have some degree of erectile dysfunction, 60% of their men in their 60s, 70% of men in their 70s, 80% of men in their 80s. That's the aging process. That's the way it happens. I've become an expert in understanding the aging process, not just sexually, but also physically, in terms of hormone levels, in terms of muscle loss as you age. And I'm really focused on what we can do to maintain physical, hormonal, and sexual function for as long as we can, knowing that, like Lenny Bruce said, no one gets out alive.
Well, let's talk about this for a second. Now, I'm 68 years old. I certainly don't have the muzzle velocity that I used to as a young man. Certainly not the frequency of orgasm and that kind of stuff. I just take it as an aging thing. But is there a way to maybe get a little bit of that back? I did see you talking about exercises specifically for strengthening different things.
Yeah. So there's two different ways we can go. One is to boost libido. Testosterone works amazingly well. And then the other thing is I just completed a clinical research study on orgasm or ejaculation. And so there's a technology that I helped adapt called high intensity focused electromagnetic waves. So it uses electromagnetic waves generated by running electricity through a large coil to generate electromagnetic fields that causes muscular contraction. So it's a device by a company called BTL called the Emsella machine. And what that does is it causes massive contraction of the pelvic floor. So they actually initially developed it for women, so women do Kegel exercises after having babies, right? And what you do is you contract the pelvic floor, and the pelvic floor is like a hammock that hangs off the underside of the pelvic bone. And when you contract a muscle, you make it shorter. And so you lift up the pelvic floor. So men also have a pelvic floor. And we also have two muscles, one called the ischiocavernosum and the other called the bulbocavernosum, that sit at the bottom of the penis, the base of the penis, and they contract when you ejaculate. And so as you get older, those muscles get weaker, just like every other muscle in your body. And you're probably use it a little bit less than some of the other muscles in your body. And so men lose velocity, muzzle velocity on ejaculation. And so by sitting on this machine for a half an hour for 5 or 6 weeks, you actually can regenerate those muscles and have much more intense ejaculation.
Can you ship one down here?
Yeah.
What are they? A couple 100,000?
Yeah, a couple 100,000.
Yeah,
about 150 grand. But if you come up to Northern California for a couple of weeks, we'll treat you to some better orgasms.
Oh, well, that's enticing. I may have to do that.
The other thing that men in their 60s really, really benefit from is boosting testosterone. Now, not every man in their 60s has a low testosterone, and not every man in their 60s, even if they have a low testosterone, needs more testosterone. So I don't just treat numbers, I treat people. Mm-hmm. And so if a guy sees me and he's 65 and his testosterone is low, it's 200 or something like that, but he's like, yeah, I feel great and I got good muscle and I have good energy and, sexually everything's all good. I won't touch him. But if someone is lethargic and mentally not as sharp as they used to be, and their mood isn't good, and they're losing muscle and putting on fat, and their libido's down, athletic performance is down, the sleep isn't as good. And I've ruled out other issues, right? So here again, it's like the pill mills that crank out Viagra. There are a lot of different reasons that you could have those symptoms, right? You could have sleep apnea and not get enough sleep, and you could be lethargic and losing muscle and not having energy. So, it's not a question of like, okay, let's sign up for a testosterone company and have them start sending me injections to do. You have to actually see a doctor who knows what the heck that they're doing and is able to rule out a bunch of other stuff. And at the end of the day, if all that other stuff is ruled out, like you could have low thyroid, right? What happens if you have low thyroid and someone's sending you shipments of testosterone?
It's not going to fix it.
So, there's some danger of going to Dr. Google and self-diagnosing and reading some of the marketing BS that's out there. You have to see someone who actually knows what the heck they're doing, so that you're not going to get the wrong diagnosis and the wrong treatment. But in the right patients, I just had a patient here, 65, and we use a body composition analysis to analyze people. So look at their percentage of body fat, look how much muscle they have, et cetera, et cetera. In a year on testosterone, he put on 7 pounds of muscle and took off 10 pounds of fat.
Wow.
Right. And he's mid 60s. And I have a muscular rejuvenation protocol at Brandeis MD up in Northern California, where we routinely get guys who in their 60s, and I build 5 to 8 pounds of muscle and take off 10 to 20 pounds of fat within 4 to 6 months.
That's incredible. Brandeis MD is your website that people can go to?
Yeah, my medical practice, my website, just brandeismd.com. I also have a YouTube channel because I do a lot of physician teaching and patient lectures and that kind of stuff.
Yeah, I loved your YouTubes. I watched, the one I mentioned, then I watched parts of a couple other ones just to get an idea. One of the part of that symptomology you were talking about for low testosterone was also sounded a lot like depression. So I'm wondering if people are being treated for depression when actually they just have low testosterone. That must happen all the time.
All the time. And it's amazing. It just, I had a super busy urology practice in Northern California. I've been voted the one of the top urologists in the San Francisco Bay Area for the past 9 years. I was chief of urology of my hospital, the local HMO, and I gave it all up to restart a male sexual medicine and rejuvenation practice because to me, it was just so rewarding to see men kind of come alive again, and when you boost testosterone, you build muscle, you give guys sexual function back. It's like, it's like the first time you kiss a girl when you're 16 years old. You just guys just light up. I mean, it's incredible.
You get a second act in life, and
yeah,
you might think it's over and it isn't.
I put guys through a second puberty. I really do.
Damn. I'm gonna book a plane.
Wish I grew more hair on my head.
I know. How come you and I are bald? You got all little cruel joke there.
Oh yeah. My son, he's 15 and a half. And man, like my wife cuts more hair off his head in one day than I have in my whole head.
Yeah. I've been bald for so long now. I don't even think about it other than where's my hat? Because I'm cold. Exactly. I am no stranger to the urologist. As a young man, I got this really serious bladder infection, which turned into prostatitis. So I've had prostate stuff for years. I'm in pretty good shape right now, but the prostate in men is a huge thing. I mean, most men have some sort of issues with it at some point, and certainly as men age, that becomes an issue. What is optimal for prostate health? Can you reverse some of the issues that happen when that prostatitis happens, enlarged prostate? It just seems like it's one of those things that almost every guy I talk to talks about the what we call it the old man pee alarm, because you're up at 2 or 3 in the morning and you got to pee, and when you'd rather be sleeping.
Yeah, I mean, honestly, I could talk about the prostate for hours and hours, but I'll try to break. Yeah. But I'll try to simplify it and break it down. Right. So there are 3 really. So first of all, most people don't even know what the prostate is and where it's located. So the prostate, the only function of the prostate is to make semen, right? And the function of semen is to accompany sperm on its journey, and it's basically packed with fructose, with sugar, to keep the sperm going. Okay, and the prostate is located just below the bladder. So when you urinate through the prostatic urethra, and the prostate is located just anterior, just in front of the rectum, which is why urologists do prostate exams to feel for prostate cancer, which usually develops in the posterior or back side of the prostate. Okay, so prostatitis is a miserable disease because the prostate makes semen, right? And what is semen? Semen's like basically molasses, right? It's just like sugar, thick sugar water. And so bacteria love sugar, right? So bacteria get into the prostate. So the prostate's supposed to be a sterile space, and urine is supposed to be a sterile bodily fluid. But if you get an infection in the urine and into the prostate, the bacteria go wild, right? They start chomping up all this sugar. They grow really quickly. And the thing is, the blood supply to that area of gooey sugar isn't very good. So it's hard to deliver antibiotics to the prostate. And the blood supply to those areas of gooey sugar isn't all that great. So it's really hard for your own immune system to swim through that sugar to get to the bacteria. And there are lots of nooks and crannies for bacteria to hide. So there are really only two classes of antibiotics that get to those things. One is called a sulfa drug like Bactrim, and the other is a quinolone drug like Cipro or Levaquin. But those drugs are really dangerous to take because they can cause tendon issues and ligament issues. And so there aren't a lot of really good options for treating prostatitis.
I've taken both of those things.
Yeah. And they're nasty, and they'll give you GI issues and all that kind of stuff. They will affect urinary issues because the prostate swells, but it swells because of infection, right? So it gives you irritative urinary symptoms like frequency, urgency, nighttime urination, burning on urination. And they give you obstructive symptoms like slow stream, intermittency, hesitancy.
Yeah, that's I've had everything you're just talking about when it was
You hit the trifecta, huh?
Oh man, it's very unpleasant, and I'm fortunate that I did change a lot of my diet over the years, and that was, I think, probably a big factor. I've eliminated sugar, which is one of the greatest things I've ever done in my life, was to get sugar out of my diet. So, because I know a lot of things, yeast and things like that, thrive on sugar. So that's the extent of my medical training right there. Everything I know is I've learned from people like you. So what can people do to maintain optimal men's health, prostate health, all that stuff that surrounds that whole area?
Yeah, well, I mean, that's a great lead into my book, which is called The 21st Century Man. And my book is over 900 pages. It's 101 chapters. It's the most comprehensive and medically accurate men's health book ever written. And it's not just me, it's me and 60 of my good friends and colleagues who are medical specialists in all different fields of medicine that relate to men's health.
Yeah, you were telling me that there was but there's also a spiritual, psychological, emotional component to a lot of the talks that are in that book.
Well, I mean, if you look at the largest study of men's health ever done, called the Harvard Longevity Study, that studied men now up for 75 years. They studied men, their sons, their sons' sons, their families. The single most important predictor of health is the quality of a man's relationships. Numero uno. So more important than taking an aspirin a day or PSA or any scan or really anything that you can do, the quality of a man's relationships determine his mental and physical health. And so if you write a book about men's health, but you write it just about, food, exercise, and sex, you're missing a whole super important component of men's health, which is mental health, emotional health, relationship health, and even spiritual health. So the book ends with chapters on inspiration, on gratitude, on leaving a legacy, and talking about the hero's journey.
I can't wait to read it. And I'll probably get through the entire thing just because the topic is so interesting. Being a man all day long, I can relate to
what we say is read the introduction and the first chapter. The first chapter is about the hero's journey, about how all of us are the heroes of our own journey. Don't worry about someone else's journey. That they have their own problems. Even if you don't think that they have problems, seeing high-level people as a physician for the past 25 years, I can promise you everyone has problems, right? Just focus on your own problems and make decisions in your life that reflect what's best for you.
Well, I think that is very wise advice, because nobody really cares about you the way you care about yourself. It really is that's all you can do is you anyway. You want to hear my favorite urology joke?
Yeah, absolutely.
I just thought you probably heard it. Do people tell you jokes about that?
Oh yeah.
The guy that goes.
We love laughing.
Okay. The guy goes to and if you've heard it, I'll just tell it to the listeners. Guy goes to the urologist. He's doing a prostate exam, and he goes, I feel something in here. I don't know what's going on. And he goes, man, and he all of a sudden he goes, he pulls out a dozen roses. He goes, there's a dozen roses in your ass. And the guy goes, read the card. Have you heard that one? No? Oh, okay. Well, there you go. You got a new one.
Awesome.
I guess he liked the doctor.
Yeah.
That was
we have other versions of that are
okay.
less politically correct.
Things you find. Let's just say that the gerbil stories are not true. Can we just say that that's never happened?
Oh gosh. I've taken my fair share of weird stuff out of people's bladders and urinary tracts.
Yeah.
Golf pencils, crack pipes, thermometers, knitting needles.
Oh. Now people were using these as the crack pipe was just to get through customs, I'm assuming.
Yeah, exactly.
But who is doing this and why? I mean, is it just like sexual gratification kind of stuff?
People use them as pleasure aids, but also, when people are on mind-altering substances, they do things sometimes that are not really beneficial for themselves.
Man, I can only imagine being that high, and then you come into the doctor. Yeah, it was kind of high Saturday night. Something happened. But good for you for helping these people. And I would hope that they never try those things a second time, because at that point I would send them somewhere else.
Yeah.
Let's talk about vitamins and nutrition and exercise and the importance of those things. And like you say, the relationship's very important, but that's not something we're going to fix in a day or anything. But there are things that people can do to enhance their physical well-being in, all areas, particularly since we're talking about men's sexual health. That would be an interesting thing for people to know where to access information.
So, a general multivitamin is something that I usually recommend. But then more specifically, there are two supplements that I think a lot of men should be taking. And one is a nitric oxide booster. And so I actually developed a nitric oxide booster called Affirm, AFFIRM. We sell at affirmscience.com. And what nitric oxide does is it communicates between nerves and blood vessels, and it helps you open up blood vessels, which improves circulation. And circulation is important for brain health. It's important for muscular fitness. It's important for blood pressure, and it's important for circulation to the penis. And so by taking a nitric oxide booster, and your body gets nitric oxide from two different places. It gets it from what we call citrulline, which gets converted into arginine, which then gives off nitric oxide. And then also you can get it from nitrates. And nitrates are things like beets, and those nitrates get reduced to nitrites and then nitric oxide. And so your body gets about half from citrulline, which is really high in things like watermelon, and half from nitrates, which are in things like beets. And if you take, like, for example, 4 tablets of nitric oxide of Affirm will give you about 3 grams of L-citrulline. It will naturally decrease your blood pressure, improve athletic performance, improve brain performance, and improve sexual performance. And then the other supplement is creatine. And creatine is used by a lot of competitive athletes and bodybuilders. And what that does is it regenerates ATP. So ATP is the fuel, the energy source that our body uses that are made in the mitochondria. And if you're low in creatine, then it's hard to regenerate those ATP is converted into ADP and energy is released. But then you have to convert ADP, which has 2 phosphates, back to ATP. And what creatine does is it grabs the phosphate and sticks it back on the ADP. So those are really nitric oxide boosters, and creatine are the 2 supplements that have by far and away the most data Now there's a whole bunch of other stuff, magnesium, creatine, quercetin. You go to any GNC or health food store and there's a million supplements in there. And, a lot of them have data, some don't have data, but really the two that stand out the most for me are a nitric oxide booster and creatine.
Where do you get creatine in foods?
So creatine's in meat and those kind of things, but you have to eat, I think, 1.4 pounds of meat to get the creatine in a 5-gram scoop of creatine.
That's a lot of meat.
Yeah, that's to put your cholesterol up to about 500. So, what I recommend to a lot of my men is just a little bit of creatine before and after a workout. Really helps a lot.
Let's see, here's 2 things I did not know anything about. Look at that. Look at that fantastic free consult that I just got.
You got your prostate issues taken care of. You got
I'm ready. I'm
creatine.
ready to...
I'm going to bring you up. We'll get your testosterone boosted up. You'll be raring to go.
He'll be unstoppable, huh? 70-year-old stud.
Well, so I'll talk a little bit about the aging process.
Yeah, great.
Okay, because I specialize in building muscle and sexual function and hormonal function in men over the ages of 50, right? And if you look at elite athletic performance, right, the 100-yard dash or the 100-yard swim in a pool, right, the times are relatively steady up until the age of 60. And then the decline begins to accelerate. And then at the age of 80, there's another inflection point where the decline increases. If you look at sort of normal folks most people peak out in terms of muscle mass at the age of 25. And then from 25 to 40, you maintain. And then from 40 to 70, you'll lose 0.8% of your muscle mass per year. At the same time, you're losing about 1 to 2% of your testosterone level per year. And then after 70, that goes up to 1.5% per year in terms of loss of muscle mass, right? It's called sarcopenia. And you get sarcopenia or the loss of muscle mass for a number of reasons. First of all, your nerves don't work as well. Second of all, you're not quite as physically active. Third of all, you don't eat as well, and you don't extract protein out of your food as well as you used to. You don't extract vitamins and minerals out of food like you used to. We all have chronic inflammation for, living in the world that we live in. Our mitochondria don't work as well, right? So they don't kick out as much ATP, as much energy as efficiently as they used to. Our DNA is constantly getting damaged by radiation, by sunlight, that kind of stuff. And then finally, there's one other thing I was thinking of. Our cells, the Golgi apparatus and the endoplasmic reticulum don't make proteins as well as they used to. And so because of all that stuff, we get older. Now, there are certain things that you can do, like boosting hormone levels, eating better, and then certain technologies, like, for example, I'm pioneering a technology called M-Sculpt, which builds muscle 10 to 15 times faster than you can do in the gym to help men rebuild muscle as efficiently as they possibly can.
There was a guy, I used to see him on talk shows named Dirk Pearson. Do you remember that guy?
I don't remember that guy.
He was really into different types of supplements, and he didn't work out at all, but he had these really pretty decent sized muscles. It wasn't like he wasn't like a bodybuilder or anything. He died kind of young, though. I don't know.
Yeah. But there was a company called Cenogenics that was built around the whole idea of living, to 100, and then the founder died, I think, in his 60s, and the Cenogenics folded. So,
Yeah, I mean, there's no way around any of this stuff. There's just improving day to day. Genetics are a good thing. I mean, if you got some good numbers,
genes, yeah.
Yeah, I'm thinking, do I even want to live that long? Because how great is it to be, healthy in 100 would be pretty great.
So there's a concept of lifespan and a concept of health span. So lifespan is, I want to live to 100, and health span is, I want to live really, really well to 80 or 90 or whatever, whatever number you want to get to, knowing that at some point we sort of become more incapacitated. But the idea is to live as well as you can for as long as you can.
Yeah, it's a tough one when I know my own father he had Parkinson's, and he was like, because I just don't want to be here. It's no fun. I'm frustrated all day long. I can't do half this, more than half the stuff I used to do. I'm not vibrant. My mind's not working like it used to. And he goes, I feel like trapped. I'm stuck. I'm stuck in a body that doesn't perform, and yet I'm not sick enough to pass away. Well, obviously he finally did, but there was about 3 or 4 or 5 years where he was literally a prisoner in this shell that wasn't, functioning. And I remember thinking, like, wow, it's just, what is it worth, the prescriptions that he was taking and the doctors and all that stuff to live? How, it's a question, I guess each person has to kind of answer for themselves.
Well, and Parkinson's is tough because we don't really know what causes Parkinson's. People just sort of get Parkinson's, but there are so many things that we talk about in the book that you can do to prevent or to catch early a lot of the diseases that cause misery and morbidity and mortality in the United States. I mean, 50% of men in the United States have high blood pressure. 40% of men in the United States are either fat or obese. 15% of men in the United States still smoke cigarettes. 12% of men in the United States don't have health insurance. And so, the book is really a springboard to learning about every system in your body: physical, mental, emotional, spiritual, sexual, to optimize the way that you live. But knowing that, we're all ultimately responsible for our own health. I mean, when I have guys that sit across from me in my office, I say to them, listen, I can put together a world-class health plan for you. There's very few people as good as me and as experienced as I am and have the technology in my office that I have to design a plan for a guy to get better. But at the end of the day, you have to execute on it. I'm not going to follow you home and tell you what to do. I got my own problems, I got to deal with. So I don't need your problems. I can tell you how to solve them, but you got to solve them on your own.
Yeah, I always wonder what the difference is between someone that's willing to do the work and someone that is not. The comfort level of, well, this is what I've been doing for 3 or 4 decades or more, and I'm not about to change it, even though I know I'll feel better. It's a really interesting dilemma for people, I think, because it's like I want it, but I want it to be super easy, and it just isn't. Right. Nothing worthwhile is easy.
No, but the thing is, so I stopped taking health insurance 3 years ago because I wanted to be able to spend quality time with my patients. Because the average physician visit in the United States is 16 minutes. Ooh. And you can't do very much. And there's a really good chapter in the book on how to make the most of your physician visit. And I have a video online too. So if you go to the 21stcenturyman.com, all written out in letters, there's a free little ebook that I put out that has a video and instructions on how to make the most of your physician visit. So just go to the 21stcenturyman.com, because I believe that a physician and a patient are in a partnership. It's not a paternalistic relationship where I know more than you do and just do what I say. Because the thing is, these days, like when I was at Harvard for research, Harvard Medical School Library was the biggest medical library in the world. It had 1 million volumes, and people would fly from around the world to go see these beautiful white columns outside of the Harvard Medical School Library, right? And now everyone on their iPhone has the same access to information that they have at the Harvard Medical School Library. So, sometimes patients are as smart as I am. They'll come in with stuff I'd never heard of before, or their products and things like that I'd never heard of before. And And so I'll sit with them in front of a computer and pull it up, and we'll talk about what it is. And if it's something interesting, I'll actually investigate it more. And if it's something that I know is fraudulent, I'll say, listen, this is just a bunch of BS marketing. But you can help take care of yourself and form a partnership with your doctor.
Yeah. If that doctor is someone like yourself who's willing to do that and understands the importance of that, it is a partnership. I mean, we heal each other. Your patients probably do as much for you as you do for them in ways that they don't even understand sometimes, I would imagine that.
Oh, absolutely. I mean, they teach me all the time, and the book is filled with stories about my patients, from my patients that, and the book really evolved from all of the issues that my patients have had, so someone comes in with erectile dysfunction, and I discover really it's not from anything other than sleep apnea, right? Because the guy hasn't really gotten a good night's sleep in 20 years. So he's not getting nighttime erections. So his penis isn't working all that well. Or, another guy, all of a sudden I think, well, I bet you this guy's hypothyroid. So we check his thyroid, and all of a sudden, boom, that's his issue. So, the chapters evolved out of, or even this is one of my favorite ones. This guy's like, yeah, doc, $100 down the drain. I'm like, what do you mean $100 down the drain? He goes, well, I know you fixed me up, but, I took the wife out to dinner, really nice restaurant. We got a good bottle of wine. I loaded up on Viagra, and I said one stupid ass thing, and $100 down the drain.
Yeah. Well, the things we say can really just jettison the whole package.
Exactly. So, there's a whole section on written by Brett Beaver, who's an amazing a therapist, on listening and different types of marital therapy, how to get the most out of marital therapy. And there's no shame in therapy. There's no shame in any of this stuff. It's just informing yourself so that you can do better.
I have learned to keep my mouth shut in the appropriate times. Sometimes my wife will say, why aren't you saying anything? And she's upset. And I'll go, because I don't want to say the wrong thing.
Yeah.
Just tell me what to say. I'll say it. Oh man, that's so funny. Thank you so much for being on here, and for your team. I guess it's a team that reached out to me. I really, really love this. I could go for, many more days on this topic, and maybe in the future, there'll be something that we can talk about again, because this is a very rich field of endeavor, men's health and sexual health. And thank you for the great work you're doing too. Damn, I'm going to get your book. I can't wait to get that, and check out the website, listeners. Dr. Judson Brandeis, thank you so much.
Oh, my pleasure. Yeah. If you're interested in the book, we have a hardcover book. We'll never go to a limp softcover book. It's always going to be a big, thick hardcover book. We also have an ebook. We're almost done with our audio book. Just go to the 21stcenturyman.com, all written out in letters, the 21st Century Man. If you want to know about my medical practice up in Northern California, we do a lot of clinical research. So we have a lot of really interesting clinical research projects. And I have folks that fly in from all around the country, and sometimes even around the world, to see me because of my particular expertise. So just go to brandeismd.com, brandeismd.com, or check out my YouTube channel, which is Brandeis MD. So a lot of my research presentations and teaching presentations to doctors, we throw up there. And then if you're interested in men's health supplements, I formulate men's health supplements. Just go to Affirm Science, AFFIRM science.com. And we have lots of information up there too. So, it's really important to be educated about these things, to be proactive, and to see yourself as the hero of your own journey, because you're going to make better choices that impact yourself and the people around you.
Couldn't have said it better. I couldn't have said it at all. Because I'm not you. Thank you so much.
Well, you be you.
I'll be me all day long.
You be you.
Yeah. What's left of me, I'll do it today. Yeah. Thank you so much. Have a great day.
Oh, my pleasure.
Much appreciation for you guys listening to The Exploding Human. Check out the website, theexplodinghuman.com, the YouTube channel, The Exploding Human with Bob Nickman, and The Exploding Human Facebook page. Again, I want to thank Dr. Judson Brandeis for a great talk and for sending me his book, which I've dove into already, so that's fantastic. And I hope you folks have a great day. Thanks so much for listening. Bye.